sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health. Well, I heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Well, today is a Friday version of the show for sure. It's a get 'em up out of town version of the show. We're going to spend an amount of time with Jerry Singleton. We had a wonderful day yesterday at the office, moving through a number of individuals, allowing them to participate in this MCG testing. Since we've introduced it here, we've literally lit the wick of enlightenment when it comes to how you can really gain quite a bit of cardiac information with no invasiveness necessary at all. In fact, almost obfuscating the need for that invasiveness. Anyway, we're going to spend some time with Jerry today talking about, well, really what we learned yesterday and talking about up-and-coming dates, some future events. It looks like you're on board, Pittsburgh, and you really did respond. We're going to be saluting you today, and of course allowing you, through the course of our discussion today with Jerry, and even after we depart, whatever might be on your mind is going to be okay with us today. The number, of course, to take over this show, to commandeer it, and to steer it in your direction, whatever persuasion that may be, 412-825-6262 is the number, 412-825-6262. Now, things are shaping up, folks. Let's see how things look now on the calendar. On Monday, last day of the month, February 28th coming up on Monday, Houston Thomas is going to be here talking about tap water and why you probably shouldn't drink it. If you didn't know already, going to be a red alert for you and bringing you some information that, should have long been gained already. Most of my listeners are well in that camp. But let's see what new information may be on the horizon about your tap water and why you should stay clear of it. Then, as we do turn the page in the month of March, it's going to go something like this. We start right off here in the month of March with a guest on Wednesday the 2nd. It is now inked. It is in the history books. We're going to have, let me get his bio sheet because he's got an illustrious pedigree in terms of all of the accolades and where are you? Okay, nonetheless, his name is Dr. M.L.K. Shandell. He is going to be the featured speaker this month at the Freedom of Choice in Cancer Therapy group goings on up there in Butler. Now, there's a whole thing you got to get used to this month because they're out of their third Thursday routine. They say just for this month, meaning the Days Inn up there in Butler, just south of Butler, scheduled another event, as I'm told, and because of that scheduling, Freedom of Choice had to scamper to get their meeting in, and so they're going to be on the first Thursday of the month, and their featured speaker is Dr. Shandell, who has developed what he calls a CA profile, a cancer profile, and is billed at being able to determine whether there's the presence of cancers in an individual way before, supposedly, any other test could ever do so. Early detection of cancer, of course, being the key. I'm going to be all ears as we have him as our guest the day preceding the Freedom of Choice in Cancer Therapy group meeting on Thursday. We're going to have him as our featured speaker and our guest on Wednesday, where we'll find out a little bit about this topic of cancer profiling, if that in fact, because he has so many accolades, go in a number of directions. Man, actually, I could be in error, and he could be talking about something completely different. We'll let him tell us about his credentials, about his work, and about what he's going to sort of titillate you with to lure you to be up there with the Freedom of Choice in Cancer Therapy group. Always a good occasion up there, sort of a nice little club, really well attended, and I just wish they were closer, folks. I wish they were closer. Then on Friday of the first week of March, we're going to bring Jerry Singleton back. Of course, he is our guest today, and the reason is we're really putting the full force of all of my reputation behind this new device, and be talking more about MCG testing many, many times as the calendars move along. Now, in the second week, as it stands right now, a good friend of mine and author extraordinaire, one that I was thinking about when he was last with us, it had to be 3 or 4 years ago at least, when the first of his now, what I understand to be many books, was released, talking about iodine in the thyroid. He is now known as the worldwide expert on the subject. Hey, I knew him when he didn't even write a book. Nonetheless, we have remained friends over time. He called me the other day, and after some brief pleasantries on how everybody's doing, it was real clear to me, with the number of books he has written and the updates, even on iodine and thyroid and the like, he consented to being our guest on the 11th. So on Friday the 11th, Dr. David Brownstein, who hails from Michigan, not too far away, is going to be our guest. And let's see what has happened, what's new. I was actually clued into a lot of changes of new from a patient. And actually what the patient told me, I didn't even believe. I said, no, where'd you hear that? She goes, well, we heard that from Dr. Brownstein. I said, no, he never said that. Well, it turns out they heard right. He said it. I was in error, and I apologize. Anyway, we're going to get me straightened out with David on the 11th. And the next week following, we're going to bring Susan Smith-Jones back. She's going to be talking about weight loss tips. She said she's got 10 of them. And as March rolls around, March Madness occurs in a whole bunch of different ways. But warm weather's coming. Weight loss issues are in the air. Let's see what this gorgeous young lady, really, with the authors of many books, 26 books she's authored. I think she may have a tip or two, but to help us all with weight loss. And we'll do that on the 16th. And that's pretty much how things are shaping up out there. Now, in the news, a couple prostate issues in the news. You already know I'm out there in the blogosphere checking out. I got to keep one step ahead of all of my listeners, who probably are a number more steps ahead of me than I ever will be of them. But a new issue came up. I thought I'd bring it to you. It is the byline says measuring changes over time leads to unnecessary biopsies. And, of course, this is not a new concept. In fact, so old a concept is it becoming that the issue about what to do about prostate cancer from the conventional medical community has taken many, many turns, and now literally says, well, you don't do anything. But PSA testing remains high on the list of recommendations, especially for physical checkups and routine blood work. And elevated PSA, which is a prostate-specific antigen, which is found in prostate cancers, has been a tried and true way of detecting the potential presence of a cancer. Now, some new term that I never heard before has also emerged. This comes out of NCI, the National Cancer Institute, and a study by Andrew Vickers of Memorial Sloan Kettering Cancer Center in New York. The term is called PSA velocity. And this is a term that is meant to attempt to describe how the magnitude of a change in one's PSA has been at least attempted to correlate with the level and invasiveness of the prostate cancer. So if you had a tremendous jump in your PSA from one year to another, the initial studies had revealed that this more than likely was an indicator of how invasive this disease should be and how really rigorous and aggressive treatment should be. Well, as it turns out, this issue with PSA velocity turns out to be a complete non sequitur, a complete not helpful in any way adage in terms of following as it would be indicative of someone's cancer invasiveness. It is not that just because you have a tremendous jump as opposed to a slow rise in PSA, there is no advantage, disadvantage, or otherwise other information to be gained in the PSA velocity. Big jumps from one year to the other don't seem to have anything to tag on them in terms of anything you can learn from it, when it was thought that it was a pretty good sign for at least a while that you could. So PSA velocity, the quick jumps in PSA from one year to another of large magnitudes. Of course, PSAs, as you know, go up to about a level of 0 to 4.5. And I've seen them very, very high, obviously, over the years. But what they were trying to say is if you had a PSA 1 year of 4 and the next year it jumped to 10, that's a pretty large jump in magnitude. This would be some indicator of invasiveness, and they evidently had been attempting to prove that that is the case. It is not, and so PSA velocity is now a term that can be just set aside. The two tried and true ways of assessing the prostate issue continue to be just your regular old PSA level, whatever it might be, and a digital rectal exam. And that's it for the new term of prostate or PSA velocity. One final other thing, because it was related, has to do with PSA, and it has to do with the PSA screening for prostate cancer. And evidently, with all of the confusion I think the conventional medical community has brought down on itself, the numbers of individuals getting PSA testing has really dropped off considerably over the last number of years. And as such, with the new guidelines, which essentially, they came out in 2008, and the new guidelines recommended against PSA screening after age 75 at all. When it was a staple item and has been for so long, the 2008 recommendation says, no, don't get any PSA testing after 75, and then noted that there was inadequate evidence for or against its benefits for men under age 75. So you can see why the whole thing with PSA testing is really in the dark now. We thought it was such a clear thing. It was such an easy thing to have done. It was a great way to follow. And as is usually the case with my boys, they have completely mucked this one up because they got too aggressive with the earlier testing and what they did about it. And whenever a treatment regime for a known cancer happens to be watchful wait, meaning don't do anything, doctor. Don't do any biopsies, don't do any of this, don't do any radiotherapy, no chemo, just leave it alone, because they say the likelihood that this patient is going to die from some other issue other than prostate cancer is much greater than if you attempt to treat his cancer alone and die from one of the complications of your treatment. Anyway, that's the new stuff on prostate screening, PSA testing, and something called PSA velocity. Okay, let's take a short break. When we return, we're going to have Jerry Singleton with us and talk a bit about, well, the festivities here yesterday. They were enormous all day, throughout the entire day. Numbers of you took me up on my offer. By the way, I'm going to have another offer for you before the morning is up. You want to stay tuned. Be back in a moment talking about MCG testing. you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough that no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan is a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor expenses cost for last year's colds and flu? Oh, I'm sorry. I've got to go. Love you.
We can do this. We can cut the fast food luncheon. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call us now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Friday version of the show. It is a get 'em up out of town version of the show, as we normally like to have for you on a Friday. We will permit you to give us a call, and really anything on your mind is okay with me. The number to do that is 412-825-6262. That's 412-825-6262. And so when I hear that knock on the door, I will let you on in the store. We decided to spend a little bit of time with you today. When I say we, our guest today is one who has been on our airways before. He has turned out to be a major presence literally in my office with a new device, a new technology that is what's captivated my interest, and it appears to have captivated yours. What I'm talking about is something called MCG testing. We have brought it to the office this month in a big way. First, a group of about 13 patients on February 3rd, and then a whole host of patients yesterday availed themselves of the opportunity when we opened it up to the public and allowed you to come on in and have this testing done. Because Jerry does represent the company that manufactures the device and has been my real connection with learning about the device and bringing its ability to help others to my patients. I thought I'd bring him aboard again today to say hello. Jerry Singleton is his name. Good morning and welcome back, Jerry. How are you doing today?
Good. How are you, Dr. Courtney?
Very great. You had a good night's sleep, I hope, because we worked you out rather heavily yesterday.
We had a busy day, didn't we?
It was a busy day. I really enjoyed seeing so many folks. I want to tell you, of course, to have heard about this meant usually that you literally had to be listeners to the radio show because it's the only way you could have known we were going to do it. And so I was running into listeners yesterday, long-time listeners. They came from afar. I had never met them before, but they just showed up because they said, hey, I've listened for you for a long time, and then brought in spouses and neighbors and people literally sometimes I met on the highway, it seems to me, Jerry, all to have this test done yesterday called MCG. Now, so that everybody isn't in the dark and continually trying to clarify MCG testing, why don't we just talk a little bit first about what MCG testing is supposed to do, and then talk about the test itself, and then some of the interesting things we learned yesterday from our patients.
Sure. And I just want to start by thanking you for inviting me back. As you said, we had a great day yesterday, and
that's typically been my experience at the offices, cardiologists and primary care physicians' offices that I've utilized this in our area. And for some of your listeners, like you said, that didn't have a chance to be involved in this, just to bring them up to speed, my name's Jerry Singleton. I work for a cardiac company in Western PA named Prologic Medical. I support two products. One is a pacemaker and defibrillator product, but this product is our newer product. It's called multifunction cardiogram.
MCG.
MCG, right.
Multifunctional cardio. I told you I didn't like that. The company needs to rename this device. It's too generic a term. You got to do better than that. But okay, that's what you're settling with right now.
Right.
I can handle it.
Right. Well, like we had explained to your patients yesterday, it's a diagnostic tool for coronary artery disease for the early detection and screening for patients, which would cover probably most of your listeners that either have some of the risk factors for coronary artery disease, maybe some family history of coronary artery disease. As you know, Dr. Horton, genetics play a big component in the major risk factors. So it's very beneficial for patients with known coronary disease as well. Maybe they're on a current high blood pressure medication or cholesterol medication. Maybe they had a stent or a bypass surgery or angioplasty. So we cover really both ends of the spectrum with this. From that early screening, and then also we can track and use it in a treatment program for patients that already have known coronary disease. And yesterday, like you said, we tested a ton of patients. We did 22 patients from all across Western PA. I know this was your first opportunity to open up to the public. We've utilized it in your office prior, but this was a very successful venture we had.
It was, and I think take all that you just said about what the test is, and I reduced it to a phrase, and I asked you at the time whether it was an accurate way of describing this. I keep utilizing it again and again, and I think it's a good way to aptly be succinct with how you should view this test. I say that the MCG testing is able to give us information specific to one's coronary artery disease status as if they had a complete cardiac catheterization, however, without having that cardiac catheterization, and therefore without any of the potential risks and side effects and complications, which are immense in terms of what could go wrong in that cath lab. Yeah, they'd find out a lot of information there, but you were able, your company was able, to bring together electronics and physics and whatever the heck else, and without any invasion at all. Really, someone's just lying on a table, having their ankles and wrists exposed. That's about it. And then 7 minutes later, how in the heck does this machine tell us? Can it tell us? How can it predict the same sorts of things that are objectively learned from when somebody has a very invasive cardiac cath? How does this device do that?
Well, that's a great question, and just before I answer that, we're certainly not trying to replace cardiac cath.
You know what? I am. You might not be. I would love to replace it, but that's neither here nor there. Look, we all understand that there's a setting for everything. I think the cardiac cath now it's like it's having 40 years of great use, but it's now. It looks as though with electronics and so forth, a lot of this is being and can be supplanted. Who knows, 10 or 15 or 20 years from now, with electronics showing how viable they are in reproducing these similar results, who knows where this is going. So I say it sort of tongue-in-cheek. Yeah, I'm trying to replace cardiac cath, but you know what? We heard some horror stories yesterday. People walked into a cardiac cath. They really didn't walk out the same as they walked in. And it's because they got the terrible consequences and the potential side effects weren't potential in them. They actually occurred.
Well, it's a very good point, and there is a lot of risk for any invasive procedure, and there's a level of risk even to like a stress test, a chemical stress test. And so the current means of testing for coronary artery disease typically associate themselves with some level of risk. And really this offers us an enormous opportunity to utilize this in a broader sense because it isn't as risky of a procedure. It has no risk associated.
There's really no risk.
Right, there's no risk. So it allows us to tackle a broad range of patients and really use it in a sense to screen for coronary artery disease and continue to track coronary artery disease in patients that we find it in. And just for some of the patients that aren't aware of what coronary artery disease is, it's the narrowing of the arteries from plaque buildup that we have over time, and that's what reduces blood supply to those important arteries that surround our heart and can lead one to have a heart attack, or it's why patients have bypass surgery, stents. Maybe you're on a cholesterol medication. So it's the number one disease type, and it's the number one killer of mankind. It's also the number one reason for emergency room visits. So it's very widespread, especially in Western Pennsylvania. So this tool offers us a way to test for coronary disease like none other. It's very accurate. It's very proven. It's taken a long time to develop this technology. We received FDA approval in 2000. I know we've made significant changes since then to tweak the accuracy, but we've been verified in numerous clinical trials and also peer-reviewed publications, CHEST, Circulation, which is the American Heart Association's journal, International Journal of Medical Sciences. We received an award from the Women's Heart Foundation. So it is a newer technology, but it's been around for about 4 years. In our area, it's been around for about a year. But to answer your question, it's a 6-minute resting test where, in a sense, what we're doing is we're taking measurements from the patient in a similar way to how an EKG would, in a sense. But then what we're doing is we're interpreting that data differently. We're using a computer analysis to run it through 6 different mathematical transformations. And then what we do, in a simplified version, is we are comparing that patient's data that we're taking in the office, and we're comparing it against our control group of 42,000 patients that we've built into the technology that have had this test done and a cardiac cath or angiography, which you and I know as being the gold standard for detecting coronary disease. So what we've done is we've been able to plot and track certain measurements or indicators, patterns, things from correlating that data together over such a broad spectrum of patients and demographics and different coronary conditions. And so what we've been able to do is we've been able to produce a test with a very high degree of accuracy, a 91% sensitivity and an 85% specificity. So it gives us a very high positive predictive value and a very high negative predictive value, giving us a phenomenally accurate tool that we can test a patient in 6 minutes. We can test any patient, in a sense, almost anybody that would maybe have family history, or maybe would even have some of the risk factors for coronary disease. Maybe they're at higher risk. Maybe they're a smoker. Maybe they have obesity. Maybe they don't have an inactive lifestyle, high blood pressure, diabetes, high cholesterol. Men over 45 are at higher risk. Women over 55, African Americans. Certainly any family history. So what we're able to do is use it over that patient population more liberally than we would with other testing, as long as the patient is active and is willing to come in and take the and do their part to come in the office to test. We can give them a score from 0 to 20 based on that patient's condition relative to coronary disease. 0 being very ideal, no detectable burden of coronary disease. 20 being, the absolute extreme. And I know yesterday when we tested patients in your office from all the way from early 30s to patients that were over 90 years old, we got a broad range of scores, and some of them were very surprising. And that tends to be the case with coronary disease because most of the time patients are what we consider asymptomatic, or where they feel fine, they live their life, and they don't think that they have coronary disease, and generally aren't ever even seen by a cardiologist or a primary care physician. They don't seek out treatment until they either have their first heart attack or until they go to the emergency room with extreme symptoms and find out that there's something more there than they thought. So this gives us the ability to track those patients that would otherwise maybe associate their symptoms with being the cause of stress or pulled muscle or something else, where they're explaining their symptoms away, like short of breath, chest discomfort, dizziness, all those associations, and combined with the risk factors, give us the ability to test those patients in a very easy fashion.
Now, the amazing part to me is that we never literally, it looks as though an EKG is being done, but really to assess, you didn't mention it today, but it always resonates in my own mind, that while this EKG-looking experience is occurring, this electronic wizardry is assessing 166 different data points throughout the body. And those 166 data points are what they were sort of assessing in the database of the 42,000, if I got this idea correct. And then comparing your 166 data points and what information it is putting into the system when stacked up against the 42,000 who had all wide ranges of cardiovascular disease, the efficacy and specificity, and I think I'm using the right terms, is well above 90%. Am I right? In terms of how it correlates?
Absolutely. Well, in medicine, we typically look at sensitivity and specificity, but if we boil that down to simply accurately defining disease burden, we found, I know in CHEST, their peer-reviewed publication, we were over 90% accurate in that peer-reviewed study. In Circulation, which is the American Heart Association, where we took an even larger pool of patients, and over 800 patients in that patient study. In that study, we looked at both patients that have either had revascularization or have not, your typically early disease burden. We looked at both ends of the spectrum, and in that study, we were very close to 90%. So to your point, absolutely correct. And most, just to kind of educate your patients, most tests are not even close to that level of accuracy. A simple treadmill EKG is where you're hooking yourself up to an EKG and walking on a treadmill for several minutes is only 45%.
Oh, I never heard that statistic before. It's the first. You've laid a new one on me. I'll never forget it. 45% accurate in predictability, huh?
That's what the experts say. So 45% sensitivity now it has an 85% specificity, but again, our test is nearly double that. We have a 91% sensitivity, and we match the specificity at 85. So we're tremendously more accurate than most of the other means out there that typically require either a stress, some form of stress induced on the patient, or a chemical like cardiolite, which is a radioactive isotope, which we inject into the patient and use X-ray technology, which you and I know as a chemical stress test or a perfusion scan. So,
you got any numbers on that one?
Absolutely. A stress test is from our data.
The cardiolite scan, you got specificity and predictability on that one?
Yes, the sensitivity of a typical stress test is anywhere.
Cardiolite stress test.
Cardiolite stress test.
Okay.
Is anywhere from 44% to 91%, depending on the patient. As you and I know, there's a degree of gender bias with stress testing, and also body type. There's certain patients, based on their body mass and if they're females, are certainly more difficult to test than males. So there's some patients you can get a very high degree of testing from a stress test, and others are more difficult. But certainly we're not trying to replace stress tests because a stress test can be valuable at taking films and pictures and identifying blockage. But if we can utilize this technology first in the patients that would otherwise need a stress test, we can identify to a high degree of accuracy if they would necessarily be even a candidate for a stress test. So we would be able to rule out a stress test in a patient with this test first, and then for your other patients out there that, again, just want to be screened for coronary artery disease, want to be proactive, and want to take as many preventative options available to them, this offers them a way to detect coronary disease even in its earliest stages. Because you and I know, Dr. Courtney, that most tests out there available to patients either provide a negative result or a positive result. a normal result or an abnormal result. This provides us a 0 to 20 score. So what we're getting is we're getting a statistical-based score, which gives us a scale. It gives us a real range to evaluate the patient. And I know after we completed our 22-patient study yesterday, we saw patients that were 0.5 and 1.5 that certainly you would consider to have that would not be positive for coronary disease, even remotely. But they do have some accumulation of plaque, and you can let them know that early enough to say, okay, look, you're a 1.5. Once you reach a 4, you're positive for coronary disease. So let's implement as many preventative measures as possible. Let's have a discussion about what you can do in your day-to-day life to make good, healthy decisions. So, Dr. Courtney, you can set a plan for them, make a goal for them to set, and track that goal. They can be, because it's a 6-minute in-office test, we can test them every 6 months, every year, whatever is needed based on their score and in their treatment plan. We can track them over time and make sure that they're not progressing to the level of coronary disease.
Well, I'll tell you, those 2 new pieces of data that you laid on me, one, and ladies and gentlemen, there are 2 kinds of the word stress test that Jerry was throwing out there, and I know how he's using the terms. There's 2 kinds of stress tests. The regular old stress test where you just hop up on a treadmill, and you heard the numbers associated with how accurate that may be in predicting your coronary artery disease, and then 45%. And then the other kind, the much more invasive kind, requiring the injection of a radioactive isotope and then the use of X-ray besides. So the radiation issue is always an important thing with me. So much more invasive. And what's the set of numbers on that one again?
Again, anywhere from 44, anywhere from 44% to 91%, depending on the patient, their body type. Males have a higher sensitivity than females, are much more difficult to test. So there's a number of variables that can influence the stress test accuracy. And certainly stress tests aren't fun, and a lot of candidates aren't even candidates for a stress test.
That's right, because of their mobility.
And their heart might not be able to take the chemical stress test.
So they actually have a stress test called a non-stress test, where you literally sit in a chair. Okay, so because some people can't be mobile enough to get up on a treadmill, they have bicycle forms of it. Then maybe we're getting a little far astray, but I think what I really enjoyed hearing is that the accuracy of this test supersedes either one of those 2. And I think that's a great point to make, Jerry. Absolutely a great point to make. Now, I'm going to take a short break. When we come back, I want you to talk a bit about the test itself. Many of those were there yesterday could attest to the fact. By the way, if you were tested yesterday and you want to call in and tell us what your experience was, we'd certainly love to hear from you. We enjoyed meeting you yesterday, and I understand I'm going to be meeting you one way or another again. And also, too, I figured out, Jerry, there had to be a way to accommodate. People came from long distances yesterday. They traveled over an hour and a half or 2 to get this test. And some accommodations had to be made with helping to evaluate that, and I'll talk about to all of my listeners about that when we return. Okay, Jerry?
Great, Dr. Courtney.
All right, we're taking a short break. We're back in a moment with Jerry talking about MCG testing. We did test 20. I thought it was 23 yesterday. You say 22, huh? 22 tests yesterday. I had just a ball meeting all of you. Be back in a moment to discuss more of this MCG testing with Jerry Singleton upon our return.
Have you been to the doctor lately? Was the big top of your complaint list? Even if your doctor asks you what you need, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, the Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit parade product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith, let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing. your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugar. That's 1-800-442-3793 for your good health. Call us now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, everybody. Welcome back once again to AM Impact on Your Health here in this Friday morning Get 'em Up Out of Town version of the show. A weekend just around the corner, and I don't know how you intend to spend it. We always like to let you come on in and help set the agenda. You can do so if you'd like. It can be on point. We're talking about MCG testing this morning. We had just completed 22 studies yesterday in the office. And but if you have an issue pertinent to that, fine. If not, that's okay too. 412-825-6262 is a number to dial us up and give us a call. Okay, Jerry, we do have a knock on the door. Are you with me, Jerry?
Yeah.
Okay, come on in the store. Hello, welcome aboard. What's on your mind?
Hi, Dr. Courtney. I have 2 questions, one about the MCG and one not. Regarding the test, I don't have any insurance, so I was wondering, could you give me just a ballpark figure of the cost so I know if it's something I could do?
There are, this is pretty much, Jerry, accepted by all insurances. There are a couple that do not accept this just yet, although you're out there trying to get them to participate, I know. Right, Jerry?
Yeah, to your question, Dr. Courtney, yeah, absolutely. We have Medicare approval. We have most all commercial insurance types out there, but there is a couple coverage gaps that we are working through, but for the most part, we have about 80%, 90% coverage with this test. For those patients that are very active in their health and would like to be tested that wouldn't maybe have health insurance or whatnot, I know, Dr. Courtney, you and I have discussed a way that
a very nominal fee, ma'am. I tell you what, probably around the order of $50. Okay. It's very reasonable. Certainly the information is so valuable for that nominal fee, and being able to know where you stand. I think that you'd be very pleased to have a test with such a nominal fee associated with it. Okay?
Yeah, that sounds great. I was just hoping, I did show up and then it was like $300, $400, $500 or something.
Oh no. My pledge is to keep this nominal. I want the information to be what you seek, and I don't want to scare people away. And I make a pledge that I'm not going to do that.
Okay, that sounds great.
And you had another question, ma'am?
Yes. One other quick thing, Dr. Courtney, is it safe to give an infant like 3 or 4 months old 1 or 2 drops of vitamin D a week?
I'm going to have to say, absolutely. Yeah, because I'm very familiar with prenatal vitamins. I'm very familiar with supplementation that's utilized in the hospital formularies, for which vitamin D. Now, the number of units per drop would be what my next question would be. How?
Well, it's 2,000. It's like the standard adult drop.
There's 2,000 per drop?
Yeah.
I would water it down.
Okay.
I'd water it down.
It's in like olive oil. Can that be watered down?
You can use more olive oil.
Okay.
Okay? I'd water it down to about 5.
Off on your wrist and then only take a tiny part of it off, huh?
That's exactly right.
Okay.
Okay?
Okay, thank you.
Absolutely.
Bye.
Okay, there you have it. Good question. Jerry, we're back together, you and I. Yesterday we met a tremendously large number of people that took this 6-minute test. For those who just stumbled across this morning and finding about MCG testing, briefly describe that test. We came up with a pretty streamlined way of making sure that this would take as little time out of somebody's day as possible. I think we hit a home run in that regard, Jerry. But describe for our listeners how the test is conducted.
Sure. It's a very quick, easy test, very painless. You come into the office. I know Dr. Courtney, and every of my offices, cardiology and primary care, operated a little differently. But I know at your office, Dr. Courtney, what we had done yesterday, a patient came in, filled out a typical questionnaire type sheet, made a copy of their insurance card, stepped back to our testing area right outside, began to take their shoes and socks off. I would take some information from them on our database, put the information into our database, and then I would bring them into the room, test them for 6 to 7 minutes. It's a 5-lead.
Now hooking them up, tell them about what gets hooked up here.
It's a 5-lead test. So what we're doing here is we're putting one electrode up on V5, and then we're putting.
That's on the chest wall itself.
Right.
So it's like one EKG pad.
Right, the left flank, and then the other 4 leads are placed on the extremities. We have like a little clamp that goes on each wrist, each ankle. So again, it's a 5-lead test. Patient keeps all their clothes on. The only thing they would remove would be their shoes and socks. If they had a watch on, that might interfere. So we ask them to take their watch off. Then they relax for 6 to 7 minutes. They lay back. We ask them not to talk during the test, not to move during the test. Again, that would affect the accuracy. We're trying to keep, it's a resting test, and in cardiology, typically we induce stress for patients in testing, but this is a test that we've calibrated in a sense to look for even the most minute strain for oxygenated blood by the heart that you might not even be able to feel or otherwise detect. But we are able to detect it in a fashion and then measurably score that, again, from 0 to 20. So for the patient himself, him or her, again, it's very easy to they relax, they lay back for 6 to 7 minutes. After the test, we unhook them. They're on their way out. We get their test result back. Typically by the end of the day, at the latest, the next business day, and then Dr. Courtney, we either bring them back into the office and review we get a very detailed report, which to yourself, we're able to detect, again, that 0 to 20 score. We're able to describe what that score means to that patient and their specific condition, and then we can also see if they likely have local ischemia, global ischemia, or both, and that's just a more defined term for the condition. So, or for other patients, I know, Dr. Courtney, that you had said when we do our next public clinic in March, for the patients that had to drive a far distance in for the test, I know we had discussed some options where you could literally review their report and do their evaluation and management consult right over the phone.
Yeah, I should mention 2 things now. One, and I'm glad you let it out of the bag first, Jerry, and that is we feeling as strong as we already have had about this, the feelings about this test. We've already set a new date for the next time you're coming to the office, Jerry, and that's going to be on the 17th of March. So we opened it up to the public for the first time, and we had that little session yesterday. We're now opening up for the second time, and you can give us a call if you'd like to come in and be part of this testing. I know people who we tested yesterday said, love to bring, and then the list just got a little out of hand. My wife, my spouse, my girlfriend. I mean, we had everybody said, I came by myself today, but I'd like to bring so-and-so. Will you be doing this again? We knew that with that kind of response, we had to have another date. You were nice enough to consent to the fact that we're focusing, ladies and gentlemen, on March 17th, and we'll be taking your phone calls to find out those of you who might be interested. The second thing we learned, and you also just intimated, there is a need, as I found out yesterday. People have traveled so far because they really did want this kind of a result. They really did want to know about their status, and they didn't want to have the invasiveness of the couple of stress tests you described. That's minimal. What about the full-blown cardiac cath? And just too many problems can go awry, and things can go awry during a cath, that they traveled the distance anyway, an hour and a half, 2 hours, to come to get the test. Well, what the public might not understand is, built into this test, Jerry, is the fact that the insurer pays for the initial test and the initial visit with the doctor, but also the insurance understands that they're going to have to go over the results, the doctor's going to have to go over the results, and that's covered by the patient's insurance. And once you have established a doctor-patient relationship, as we do on the first day, then it is perfectly legal, appropriate, and I felt needed to be made convenient so as to prevent the need for somebody to return back to me to discuss the results. I can easily enough do that on the phone. Of course, we're going to discuss a plan on that second consult, which I'll spend some more time on a different show, talking about what to do about that score and how to improve it or at least maintain it if you have such great results on it. But I think those two announcements today, Jerry, needed to be made so as to make our listeners become more comfortable with this. Number one, we're going to be back on the 17th, and number two, if you travel a great distance, I'm not going to compel you to have to come back to talk to me face to face. We can do it on the phone. The insurance coverages that you have will cover that consult, so that's another expense that you will not have to worry about. I wanted to make sure I got those two things out, Jerry.
Absolutely, and to your point, it was very encouraging to see, I know we discussed this, to see so many patients taking an active participation in their health. And we keep talking about cardiac cath. Most of the patients we tested yesterday would not have been a candidate for a cardiac cath because they simply, didn't have enough symptoms for it and so forth. And so again, this gives us the ability to use this almost in a screening tool capacity for patients in their 30s and their 40s. I've tested patients in their late 20s, 50s. So it gives us the ability to test patients early in those asymptomatic patients, which again is over 50% of the time they feel fine and they don't experience any symptoms until they have an artery literally begin to close on them and they get severe chest pain and so forth. So it was very encouraging. In this country we have to stop just treating sick people. We need people to seek out treatment when they're healthy. And we saw that yesterday. It was very encouraging. And yes, to your question, it's covered by most all insurances and Medicare. And so patients out there should take full advantage of this. They should schedule this. They should come with a friend or family member.
Yeah.
If I were a patient, I would want to know, and I've said this before to you, I'd want to know my weight, my blood pressure, cholesterol, and my MCG score.
And my MCG score. Okay. We got another knock on the door. Come on to the store. Hello. Welcome aboard. What's on your mind?
Two quick questions, Dr. Courtney.
Sure.
When do you just do this on these special days, or could a patient schedule this for a regular appointment?
Here's what's going to happen. In the next month or two, we're going to have the device available to us only on a special day, okay? But I'm going to say, Jerry, that by the time the end of April rolls around, the device is actually going to be in my office at all times, and so any patient who happens to be seeing me for any other reason, or they could come specifically for that reason, could do it any day of the week. But for right now, while we don't have the device available just yet that can remain in my office, we're only going to have it available once a month, and we've already set our March date. If it's something you need sooner rather than later, take me up on the opportunity on the 17th. But ultimately in the future, Jerry, we will have a device available at all times in the office to do these studies every single day.
Right, and I think that just goes to the point that, again, this is a very mainstream technology. It's very proven. It's very accurate. It's very accepted by the medical community, and it's slowly growing in our area. It's only recently made a presence in the past year or so where it's been available in other areas for an extended period of time.
That's right.
It's one of those things where I think patients should really seek out and try to experience.
Well, you aren't going to be able to find it. Sir, you had another question?
Yes, sir. Does Medicaid cover it?
Medicare. Jerry, you know more about these insurances than I do.
You know what, that's a great question, and I know they've made some recent changes to Medicaid, and there's 4 different types of Medicaid. I know there's Gateway, Access, Unison, which I think United Health has recently taken over, and I think there's a UPMC Medicaid program as well. That's something you'd have to call back into Dr. Courtney's office. We'd have to explore for you.
You've never had one of those patients yet? You've never had one yet, huh?
You know, we have tested Medicaid patients. Every area has different pockets of coverage. Now, I know for all the other insurance types, we're pretty good on. Medicare, we're obviously fine with. Medicaid, it depends on which type of Medicaid you have, and we would have to explore that if you called into Dr. Courtney's office.
I tell you what, in the worst case scenario, sir, it's only going to cost you $50. How's that?
All right. Thank you, gentlemen.
Absolutely enjoyed having the opportunity to speak with you. All right, Jerry. We're literally up at the gong time here, and what was just supposed to be a casual discussion between you and I literally just turned out to be a full show. I enjoyed that. That's fine with me. I think our listeners did too. This issue of the March 17th, folks, take me up on this in terms of coming on in to get this test done while we're in this. It was a nice thing to see all these people clustered. They had a good time sitting out in the waiting room, for God's sake. We'll be having Jerry back on the show again, Jerry, and they're going to spend just a moment with me. Well, no, you're going to be a guest on the 4th. Next Friday, you're going to be back. So, heck, it's only going to be a few days till we see you again. You have a wonderful weekend, Jerry. Thank you for your assistance yesterday, ladies and gentlemen. With those bongos in the background, this is Dr. Dennis Courtney with Mr. Jerry Singleton saying so long for an impact on your health.
Impact on Your Health is sponsored by Dennis G. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002.